In this video, we're going to talk about a super common question I get from folks who are seeing me for treatment of a buried penis is timing of surgery, when they should have their surgery. Should they lose some weight first, or can they go ahead and get the surgery whenever they need it? So first of all, what do I mean when I say buried penis? So in some men, when they gain weight, all their weight for whatever reason goes to their pubic area. And if it becomes enough, it can hide the penis partially or even completely. And this condition is called a buried penis. If this goes on for many years, it can cause hygiene problems, balanitis, infections of the penis, and eventually chronic skin problems as well. Now, the treatment for this, most physicians will tell you, is primarily weight loss, and that is true to a certain extent. However, many patients I treat for this condition have already lost the weight, and you see the problem is that they just carry so much tissue there that when they lose the weight, even though the fat may be gone, the excess skin is still there and still causing the same problem. So that's in that case when we have to do a surgical fix for this, which is a pubic lift, a monsplasty. We usually combine in liposuction, and sometimes, depending on the severity of the condition and the patient's anatomy, we may have to do some extriceps to anchor the skin around the penis as well and stop it from retracting again. So does a patient have to lose weight before this surgery? So in this case, I don't have a blanket rule for this. We treat each patient individually and look at their situation. The magic number is usually a BMI of 40, because when we look at the studies, we know that above a BMI of 40, we're more likely to have complications. This can be complications with the anesthetic itself, and infections and fluid collections after surgery are more common the higher the BMI is. Of course, a BMI of 40 is pretty arbitrary. It's not like it just suddenly switches once you get over that BMI, but usually in studies, that's how we segregate out patients and know what their outcomes are. The second important reason that a patient's BMI and whether or not they're above or below 40 is important is logistics, because here in Florida, Miami, Florida, where I practice, like many places in the United States, we're not allowed to do a patient with a BMI of over 40 in a regular surgery center, which means we have to do them in a more specialized setting, such as a hospital. So as most patients are going to be paying for this out of pocket, that can make a big difference, because obviously hospitals are more expensive for patients. So we do have to factor that into the discussion. Something else that has really changed the game when I have these discussions with patients is whether they have tried GLP-1 agonists or not. And what I mean by that is the new classes of drugs, Ozempic, Wegovy, Mounjaro. These are very effective for weight loss, and it's really a game changer in medicine because it is the first time we have something that actually works. And the really exciting thing is there are even more effective medications coming down the pipeline. So I usually will suggest that a patient at least discuss them with their primary care docs, or we can refer the patient to a specialist in these medications to see if they are indeed a candidate. The other thing, of course, to remember is if weight loss is in your future, I always recommend being as close as possible to your goal weight before we do the surgery. And the reason is when I go in there and do the pubic lift and get rid of the excess skin, I can be as aggressive as possible. If, for example, we do the surgery and you still have another 100 pounds to lose, well, you could get loose skin again. And it's not like the surgery is going to reverse, but the surgery doesn't cater to your goal weight and the ideal body you're shooting for. So really, to get the best longevity out of your result and more bang for your buck, so to say, it's usually best to be as close as possible to that goal weight. One other thing to keep in mind is we need to make sure we're stable at that goal weight, ideally for a few months before we do the surgery, because you have to do a lot of recovery after surgery, and your protein levels and nutrition needs to be good to support that. A lot of men who lose weight and have this condition may actually be better served by having a tummy tuck or a masculinizing abdominoplasty at the same time as their pubic lift when they lose the weight. We'll discuss that with the patient. We leave it up to them. An abdominoplasty is more surgery, but of course we'll be able to address the lower abdomen, outer hip sometimes as well. We can combine in liposuction, masculinize the area if the patient wants to do that. It does combine very well with treatment for a buried penis. So I hope this is helpful. This is a problem that really doesn't get talked about enough. And like I said, I see it very commonly in my office. Like 3 patients in my office today we visited with. I'm based here in Miami, Florida, but I have patients who actually fly in from all over the world for this specific procedure. If it is of interest to you, please reach out. My link is in the bio. We can set up a virtual consult, and I'd look forward to meeting you.